All right, guys, so today on Talk About It Tuesday, we are talking dizziness. So this can be a very, very complex issue. We're just going to talk about one important aspect, and it is the Bermuda Triangle of the body, and this is known as the suboccipital triangle. So for my upper cervical docs, you guys know this in and out, okay, and how it relates to not only is your head on straight, but a global function, okay? So this is like the brain mapping system of the body. Now there's these small receptors within the suboccipital triangle. So these are muscles that attach from here to here, here to here, here to here, and then there's one that also attaches out here and up there. Okay, so 4 very important muscles. Now these were studied extensively. They cut these muscles down and they looked at the amount of muscle spindle fibers. And what muscle spindle fibers are, they're tiny receptors within the muscle that tell the body where it is in space, okay? So let's take my finger, I'm gonna put it behind my back. I'm gonna use all my senses, okay? So I can't smell this, I can't see it, I can't hear it. How do I know that my finger is behind my back and that it's moving? This is the 6th sense, okay? It is called proprioception. Extremely underrated, but extremely important, okay? And the highest concentration of those muscle spindle fibers for proprioception are located within the suboccipital triangle. Hence, therefore, it is so important to have these things well aligned. It is important to have a well aligned upper cervical area, because if you don't, your balance is going to be off. The input into the central nervous system is going to be off into the cerebellum. All those balance things are going to be affected if this area is not tidied up. Okay, now there's a pilot study coming out of JMPT, which is the Journal of Manipulative Physiotherapeutics, and it examined chronic neck pain, standing balance, and atrophy of the suboccipital muscles. And what they noticed is that they had these people stand on a force plate and measured their balance. They also correlated it with MRI imaging for atrophy of the suboccipital muscles. So when these muscles are not strong, your head is all wickety balancy like this, it is going to affect how the rest of your body moves. Now, how do you strengthen these things? One of the best things that I've found is called the iron neck. This is really, really cool. So they use this in MMA, football. So basically you have this attached to a rig or something like that. You can do rotation, okay? And you can do protraction, retraction to strengthen those muscles. So a very nice apparatus that I use with patients. Now, it does have a global effect when these muscles are off. This was a study out of, I think it's the Journal of Physiotherapeutics. Basically what they did is they took people that had shorter, tight hamstrings, defined by straight leg raise test, which is an orthopedic test, and they did like a self myophagical release technique within here. What they noticed is that when they had people massage those or release those muscles, what happened is the hamstrings got less tight. Now, why did that happen? Complex between neurological reactions plus the fascia system down through the hamstrings. Their hamstrings elongated and they had better motion, better control of the hamstring muscles. Okay, so it is extremely important to have your head on straight, strengthen the muscles, because it's this area is tidied up. If you're feeling chronic neck pain, fatigue, those things in the upper shoulders, you're probably going to have some sort of dizziness or headaches combined with that. Okay, this has been Dr. Kelly Duffner on Talk About It Tuesday. We'll see you next Tuesday.